Hello, my name is Eri Beltran and today I will to talk about Niraparib in patients with newly diagnosed advanced ovarian cancer. Summary. Niraparib, a polymerase inhibitor, with a significant increase in progression-free survival among patients with recurrent ovarian cancer after platinum-based chemotherapy, regardless of the presence or absence of mutation.
The ovaries are the female reproductive glands. They consist of three types of cells: epithelial, germ, and stromal. When the cells in the ovaries grow abnormally, they develop into tumors that can be non-cancerous or cancerous. If cancerous tumors are not detected early, the cancer cells can spread from the ovaries throughout the pelvic region and continue to spread to the abdominal area and other organs. Determining the stage of ovarian cancer is very important in developing a treatment plan. At stage 1, cancer is limited to one or both of the ovaries. In stage 2, ovarian cancer extends to the pelvis area. In stage 3, ovarian cancer has spread to the abdominal region. In stage 4, ovarian cancer extends into the liver, or to locations beyond the abdominal area. Ovarian cancer treatment typically includes surgery, chemotherapy, radiation therapy, or a combination of therapies.
Application. If the patient experiences severe side effects, the doses should be adjusted, temporarily stopped, or permanently stop the treatment. Pros and cons. Niraparib is effective in patients with recurrent ovarian cancer after platinum-based chemotherapy. On the other hand, the efficacy of Niraparib in patients with advanced ovarian cancer is unknown.
So some of the common side effects of cancer treatment seems to be fatigue, weight loss, and nausea. Let's tackle those one by one and hear how you can help possibly manage some of those side effects with diet and exercise. First, fatigue. What is a good diet plan for a patient going through chemo and has fatigue?
So fatigue is actually the biggest and the most common complaint of patients, not just patients that are getting chemotherapy, but patients that are also getting oral chemotherapy, so not just IV, oral as well. The common misconception with fatigue is that if you are tired, you sit down, you rest. Chemotherapy fatigue, actually the biggest and the best way to treat it is through exercise. So patients that are more active, patients that are involved, patients that do light exercise, yoga, some type of physical activity tend to do better and tend to have less long-term effects of fatigue.
So it's that pushing yourself a little bit when all you want to do is lay in bed.
Correct. So it's the opposite of what we tend to think.
Now, another side effect of cancer treatment is weight loss. Is something that you experience. Patients don't have appetite, they're not hungry. So why is it so important to maintain a healthy weight and be in a good nutrition plan while going through cancer treatment?
Several reasons. First of all, obviously when you're going through chemotherapy, you need to be able to have a good nutritional status. High protein diet will help reproduce that bone marrow. It'll help with some of that fatigue. It'll help some of those side effects that could actually happen from the chemotherapy itself. So we try to really push diet. We really try to push adequate nutrition, through nutrition consults, to just try to make sure that they're getting actually a well-balanced diet. High protein, is crucial and helps with the fatigue. It'll help with prevent the weight loss as well, and also healing after surgery.
It all works together.
Problem applied in Ecuador. Ovarian cancer represents the third cause of cancer at any frequency in the gynecological area and corresponding to the highest number of occasional deaths. Its frequency is around 4% of women's cancers. Conclusion. Ovarian cancer patients who receive Niraparib had significantly longer progression-free survival than those who received placebo.